It's my pleasure to introduce our dear professor, Dr. Inass, the president of the ASD. It's very difficult to introduce my professor. She is the one who taught us diabetes, what's meant by diabetes. She will talk today about the SOLI-D evidence for glycemic control. Thank you, Dr. Inass.
Thank you very much. This is the Sanofi Symposium, and maybe I'm going to speak sometimes in Arabic because it's more easier to explain the studies. We have today the SOLI-D study. I'm introducing this newly announced evidence for glycemic control. Introducing the fixed ratio combination to the market, and we knew the theory from fixed ratio combination. Fixed ratio combination is a combination of basal insulin together with GLP-1 receptor agonist, and we have here the SOLI mix molecule, which is a fixed ratio combination between GLP-1 receptor agonist, lexinatide, together with basal insulin, insulin glargine. This is considered an alternative to premixed insulin in some countries like China. In China, it is a premixed insulin country. They favor the use of premixed insulin. في الصين بيحبوا premixed insulin. هو أكتر حاجة من الحاجات prescribed insulin in China is the premixed insulin. And this study was done, the SOLI-D was done in China. The fixed ratio combination in China is recommended as first-line insulin therapy in elderly patients with type 2 diabetes. يبقى هم هناك زي فيفر ان هم يدوا بعد الاورال ميديكيشن لما العيان يحتاج انسولين، بدل ما بيدوا بريميكسد انسولين، بدل ما بيدوا بيزال بولس انسولين، ابتدوا يقولوا ان احنا محتاجين ان احنا ندي فيكسد ريشيو كومباينيشن. Glycaemic is once daily injectable fixed ratio combination. Like we said, it's a combination between insulin glargine, 100 unit per milli, and GLP-1 receptor agonist lexinatide. The efficacy and safety of Glycaemic was fully investigated in the Lexilan program, Lexilan L and Lexilan O, and also in an important study which is SOLI-Mix. SOLI-Mix was comparing the combination, the fixed ratio combination of Glycaemic versus the premixed insulin, and it proved safety and efficacy-wise. In this study, the SOLI-D study, there is comparison, head-to-head comparison, and randomized control trial comparing the IDEC aspart insulin, degludec aspart combination versus the efficacy and safety of Glycaemic, a fixed ratio combination of what we know as Soliqua. The study compared non-inferiority efficacy between the two preparations. This is the main objective of the study, to prove they are non-inferior. They wanted to prove that Glycaemic is non-inferior to the combination of IDEC aspart. And if we're going to find other objectives or other good results, we're going to see in this trial. SOLI-D is the first, like we said, randomized control trial, head-to-head trial, comparing efficacy and safety of Glycaemic with IDEC aspart in patients with type 2 diabetes which were not controlled on oral antidiabetic medications. This is the study population. The study population, adults above the age of 18, they have type 2 diabetes at least for 1 year duration, and they are treated with 1 or 2 oral antidiabetic medications for at least 3 months with metformin together with second oral antidiabetic medication. A second oral can be sulfonylurea, glenide, alpha glucosidase inhibitor, GPP4 inhibitor, or SGLT2 inhibitor. So all oral anti-diabetic medications were used in this trial. And they had body mass index less than 40. The hemoglobin A1C was 2 groups. One group with hemoglobin A1C between 7.5 to 10% if the patient was receiving metformin together with any oral antidiabetic medication except for SGLT2 inhibitor. For the group with metformin together with SGLT2 inhibitor, the hemoglobin A1C range was extended to 11%. This is a 24 weeks open label phase 3 trial. Like we said, compares the efficacy and safety of iGlar-Lexi versus idec-aspart. Adults with type 2 diabetes not controlled adequately on oral antidiabetic medications. The iGlar-Lexi was given once daily with or without metformin and with or without SGLT2 inhibitors versus the idec-aspart once daily with metformin and with or without SGLT2 inhibitors. And the primary endpoint was non-inferiority in hemoglobin A1C reduction in the group receiving iGlar-Lexi versus idec-aspart. This is the primary endpoint, like we said, non-inferiority. This is the main primary endpoint to prove that iGlar-Lexi is non-inferior to the idec-aspart after 24 weeks from the beginning of the study. The secondary endpoints, if the iGlar-Lexi is superior to idec-aspart, we're going to see, and the percentage of those patients achieving less than 7% hemoglobin A1C reduction, the weight effect, the presence of hypoglycemia or absence of hypoglycemia, all these were secondary endpoints. This is a titration algorithm for the iGlar-Lexi and also for the idec-aspart to test the fasting SMBG. If above 140, we're going to increase 4 units. If between 100 and 140, then we're going to increase 2 units. If the glycemic target is between 80 and 100, there is no change in the dose. And if the patient is between 60 and 80, we reduce 2 units. And if less than 60, we reduce 2 to 4 units. These are the baseline characteristics. There is no difference between the 2 groups receiving iGlar-Lexi or idec-aspart. As regards the age, the percentage of males and females, the body mass index, the duration of type 2 diabetes, the baseline hemoglobin A1C was around 8.5 in both groups. The fasting plasma glucose in both 10 millimole for both, and 7 points SMBG was almost similar between the 2 groups. This is the primary endpoint. The primary endpoint was the mean hemoglobin A1C reduction from the baseline to week 24. And in the group of iGlar-Lexi in the purple color here, there was a reduction from the baseline of 8.5 or 8.6 approximately to 6.2 6.6%. Then there was 2% reduction in hemoglobin A1C by the end of the study. And in the group of IDEC Aspart in the dark color, the gray color, there was reduction to 6.8 hemoglobin A1C. Then we have a significant difference between hemoglobin A1C reduction in the both the groups. It was better in the group receiving iGlar-Lexi when compared to the group receiving IDEC Aspart. This is considered significant difference between the two groups. And to the right side of the slide, this is the mean change in hemoglobin A1C from the baseline to week 24. There was 1.9% reduction in the group receiving iGlar-Lexi versus 1.68 in the group receiving IDEC Aspart. This is a significant difference. Then iGlar-Lexi was not inferior. It was not just non-inferior. No, it was superior in the effect in hemoglobin A1C reduction. This is other secondary endpoints, the weight. The fixed ratio combination of iGlar-Lexi is not considered for weight loss, but we can find here there is minor weight loss of -3 kilograms weight loss, but when we compare this -0.3 kilograms loss in the iGlar-Lexi to what happened in the group receiving IDEC Aspart, there was increased weight of 1.2 kilograms. Then there is a difference between the two groups of 1.5 kilograms to the best of or in favor of iGlar-Lexi. يبقى لما بنقارن الوزن بنلاقي ان iGlar-Lexi نزل شويه صغيرين، لكن الايدك اسبارت زود الوزن، فكده في فرق. وطبعا احنا دايما عيان الانسولين بتاعنا خايف من زياده الوزن، فان انت تديله انسولين without weight gain ده الحقيقه ان دي بتبقى ميزه جامده. Confirmed symptomatic hypoglycemia. Confirmed symptomatic hypoglycemia level 3 hypoglycemia ما كانش موجوده في التو جروبس خالص، ولكن level 2 hypoglycemia whether incidence rate or event rate في الناحيتين كانت in favor of iGlar-Lexi زي ما حضراتكم شايفين الاثنين whether AGA level 2, AGA level 1, confirmed symptomatic hypoglycemia, they were in favor of iGlar-Lexi في حالة الانسيدنس. طيب في حالة الايفنت ريت برضو هتلاقوا حضراتكم على الناحية اليمين الconfirmed symptomatic hypoglycemia ال AGA level 1 and AGA level 2 hypoglycemia كانوا in favor of iGlar-Lexi versus IDEC Aspart. يبقى احنا برضو بنتكلم على safety، يبقى انا بتكلم على better efficacy and better safety. Nocturnal hypoglycemia برضو دي نقطة مهمة جدا whether incidence rate or event rate. الهايبوغلايسيميا كانت أقل في المجموعة بتاعة iGlar-Lexi، كان واضح جدا الفرق هنا whether incidence rate or event rate الاثنين in favor of iGlar-Lexi versus IDEC Aspart. This is the patients achieving hemoglobin A1C less than 7%. زي ما احنا شايفين على الناحية الشمال ال percentage of patients achieving hemoglobin A1C less than 7% كانت 72% في مجموعة ال iGlar-Lexi compared to 59% في مجموعة ال IDEC Aspart. لما شافوا الناس اللي وصلت لهيموجلوبين A1C less than 7% with no body weight after 24 weeks of the study كانوا أكتر في المجموعة بتاعت iGlar-Lexi، كانوا 40% في مجموعة iGlar-Lexi compared to 21%، يعني تقريبا الضعف أخذ achievement of hemoglobin A1C less than 7% with no weight gain. المجموعة الثالثة narrower بقى، يعني narrower sector of the study المجموعة اللي achieved hemoglobin A1C أقل من 7%، وكمان no body weight، وكمان no hypoglycemia. كانوا برضو أكتر، كانوا 26% في المجموعة بتاعة الأيجلارليكسي compared to 13%، يعني الضعف في مجموعة الأيدك أسبارت. This is again the change in 7-point SMBG from baseline to week 24. Iglarlixy showed lower SMBG at the majority of the time points. هنشوف فوق هنلاقي ده البيز لاين قبل البداية، تقريبا البيز لاين بتاع الاثنين كان زي بعض في ال 7 points SMBG. هنلاقي بعد كده تحت اللون الموف هو ده الايجلارليكسي. هنبص نلاقي ان هو كان اقل في الوقت اللي هو بعد الفطار، البلاد جلوكوز كان اقل من المجموعه اللي اخذت الايدك اسبارت. ليه؟ لان في الحاله دي الحقيقه ان هم في الصين بيدوا الفيكسد ريشيو كومباينيشن بيفور بريكفاست، وده اللي باين هنا ان كان في بوتنت افكت بعد البريكفاست على طول. ولكن باي ذا اند اوف ذا داي عند الدينر الاثنين زي بعض، يبقى انا بقدر اقول ان الايجلارليكسي ما هواش شورت اكتنج، لا ده هو جايب لي نتيجه لغايه بالليل. احنا عندنا في مصر الحقيقه بير ليبل ان احنا ندي الايجلارليكسي before the main meal whether it is lunch or dinner، لكن حتى لما ادوها قبل البريكفاست ادت better effect compared للمجموعه اللي اخذت الايدك اسبارت، سواء كان بعد البريكفاست او بعد اللانش، اما بعد الدينر الاثنين كانوا زي بعض. This is again the change in postprandial blood glucose from the baseline. زي ما احنا شايفين هنا هو ده اللي بعد البريكفاست، ده التشينج from baseline. بعد اللانش ده التشينج of baseline، لكن المين ديفرنس في كل الميلز كان on behalf of ايجلارليكسي اكتر من الايدك اسبارت. طيب هل احنا جبنا better hemoglobin A1C reduction with better weight with better low incidence of hypoglycemia على حساب الانسولين دوز؟ لا بالعكس، انا كان عندي هنا في lower insulin dose في الايجلارليكسي. المين انسولين دوز كانت 28 units versus 34 units في المجموعه اللي اخذت الايدك اسبارت. يبقى احنا بنجيب better primary and secondary endpoints with lower insulin dose. This is my conclusion about the SOLI-D trial. SOLI-D trial is a 24 weeks trial, head-to-head trial. In patients with type 2 diabetes not controlled on oral antidiabetic medications, iGlarlixy versus IDEC aspart. They proved non-inferiority of iGlarlixy and statistical superiority in hemoglobin A1C reduction. Also superior body weight benefit. More patients achieved the composite endpoints with lower risk of hypoglycemia, and there was no unexpected safety findings. Then iGlarlixy should be considered a valuable option for advancing treatment in patients with type 2 diabetes not controlled on oral antidiabetic medication. This is the conclusion of the study, and thank you very much.